Okay, first I'm going to name my 9 steps. I would have a 1-inch border. I would have a sterile garb in my sterile environment. I would limit my time that my sterile environment is open. I would not turn my back on my sterile environment. My skin is not sterile. If I broke this sterile environment, I would be honest about it and I would correct myself and start all over again. And then I would have a downward flow of my sterile water into my sterile bowl. And then, when I have my gloves on and I have my sterile equipment on, I would keep it up on my waist. I think I got them all. Okay. So, before I'm entering, I would knock on the door. I would say, hello, my name is Jennifer Adams. I'm a student at Southwest Tech. How are you today? I would provide privacy. I would look at the doctor's orders, and I would say, can you give me your name? Say Bob. And date of birth, 12/18/86, okay. And then I would say, do you have any allergies? And they would say no. And I would check the wristband to my doctor's orders. Then after that, and then I would say, today, is it okay? I'm going to be doing an asepsis bandage change on you today. And then I would put hand sanitizer on or wash my hands. For this first part of the procedure, I would wear non-sterile gloves for this part, so I put those on. Then I would take the bandage off, and it's on the abdominal area. So I would put some pressure on it and then slowly rip the tape off on each side. I would take it off, lift it up. I would see how much the gauze that is under here is saturated and if it went down to the ABD. And then I would say the color of it, and if it's pink, it would be sarsaguinol. And then if it was green, it would be the purental. And then I would say about the odor, if there was any odor. And I would say that it's like a dime size or a quarter size, however much has been saturated. And then I would throw it away. So I put that in the garbage. Then I would take off my gloves. Before I actually was supposed to do the bandage, I would tell them that I knew that I came in here 30 minutes prior. Your pain was at a 9 out of a 10, and I would ask what their pain is now and say if they said it was a 5, and then I'd be like, okay, if it still wasn't improved, I would ask the doctor. And then after that, I would start my procedure. So the first thing I would do, and after I take off my gloves, I'd wash my hands again before I'd start the procedure. So the first thing I would do is check all of my equipment, make sure I have it all here. I would look at the packaging, make sure there's no rips, tears, it's been open, or it hasn't been saturated with water, because if it was, then it wouldn't be sterile anymore. These packages are open because I'm practicing. So I make sure I have all that, and then I make sure that I have my right sterile water and that it's not expired. So first, I would do my sterile cloth, I guess you want to call it. So I do one end first, and I do this end. Okay, and then I'd make sure that I would only grab the corner, and I would have to always keep everything above my waist. That's another thing I missed. I would put the bed up to my waist, and I would have my my stand up to my waist as well. So then I would grab the end of this and I'd let it fall through. I would not shake it, and I would just grab the other end of it, and then I would put it down. And anything that is hanging over is not sterile anymore. So then I would do my bandages. I would open it up. Again, this would all be at waist level. And I would drop it onto my sterile environment. Make sure it's in that 1-inch diameter. That is not in my 1-inch diameter, so that's the point where I would have to start all over again. I know that, so I'll just redo it there. Okay, and then I do my clamps. That's not in my 1-inch diameter either, so I have to start all over. And I'd have to have this also, so I put this down on the edge. Throw those away. Okay, and before I put my sterile gloves on, I would look at my sterile normal saline here. I would make sure that it is normal saline and that it's not expired. Expires 5 of 18. I do that 3 times. So normal saline, 5/20/18, normal saline, 5/20/18, normal saline, 5/20/18. Also, I would have to have the label put facing into my palm, so when I'm pouring it, it does not ruin the label. When I open it, if I was to put the lid down, I would have to have it upright, and I would stand at the corner of the lip, and then I would pour some in, and then I would just put the cap back on. Then I would do my gloves. And I gotta make sure my gloves do not touch my sterile cloth. And I would have my gloves facing towards me. So since my hands are not sterile, but I can touch the outer part of my glove here at the wrist. And I'm right hand dominant, so I put my right hand in first. Again, always keeping everything at my waist level. And being this is sterile, I can touch my sterile glove anywhere with my sterile hand. But I'm going to put my 4 fingers into here, into the cuff part, and put my fingers in. And now I'm sterile. So now I got to keep my hands up on my waist at all times. And if I needed to, I would move my paper out of the way. So then I would put my gauze into the bowl. Put it in the bowl. I grab my tweezers. Again, it would have to be in the sterile field, and I noticed that I lifted my tweezers up, so I would have to keep them down at all times and I have to start all over. I make sure this is saturated really well, and then when I pick it up, I got to make sure not to shake it, just let it drip so there's not so much liquid on there. I would pretend there's like a tube here. I would hang on to it with my sterile glove. But being I have this, my sterile hand on here, it's not sterile anymore, so I cannot move that hand away from that part. So I would hang on to it, and I'd move, and I would take one swipe around it, and then I would drop, and then in the garbage. And then I would take my other one, make sure it's saturated, I wouldn't shake it or anything, and then I would come around and do another one swipe, and then I would drop it. And then these are, they're not sterile anymore, so I put them there. Then I would look at the, oh my gosh, I would look at the color of it to see if it's red or if it's inflamed or there's any sores or if it's draining or if there's an odor coming from it. And if there wasn't, then I would put my dressing on. So then I carefully lay it down there. Put it on. And then I would take my ABD and I would cover it. So now that is done, I could take off my gloves and wash my hands. And then I would get my tape and I would tape around it, make sure it's down and intact to the skin well. And after I was done, I would take my gloves off, I guess the proper way. I would take my gloves off and then I wash my hands. And then I would ask the patient if I have time today, is there anything else I can do for you? And if they say no, then I would document and chart everything that I just did.